Assalamualaikum. I'm Kuratulan Qureshi. My roll number is BP 1650174. I'm from Group 15. The topic for my presentation is from chapter Essential Hypertension, and I'm going to discuss the treatment about the hypertension with the class of drug diuretics. So, first of all, I'm going to start with giving review about the hypertension. What is hypertension? Hypertension is a long term medical condition which is also known as the high blood pressure, in which the blood pressure in the arteries is persistently evaluated. Hypertension is classified by two measurements, systolic and diastolic pressure, which are maximum and minimum pressure. Long term high blood pressure is a major risk factor for many serious medical conditions such as angina, heart failure, heart attack, kidney damage, and also leads to kidney failure. Types of hypertension includes essential hypertension, secondary hypertension, pseudohypertension, and white coat hypertension. So, essential hypertension. Essential hypertension is also known as primary hypertension, as the cause of this type of hypertension is unknown. It is defined as a high blood pressure in which the secondary cause, such as the renovascular diseases, renal failure, pheochromocytoma, and aldosterism or Marilyn from the monogenic are not present. Essential hypertension accounts for 95% of all cases of the hypertension. It's a heterogenic disorder with different patients have different causal factor that leads to high blood pressure. As we all know that there are several drug classes for the management and the treatment of hypertension. Diuretics is among them, one of them. Diuretics is a class of drug that promotes diuresis, the increase the production of the urine. Diuretics drain out the fluids from the body. For diuretics, remember three D's. Number one, decrease blood pressure. Number two, drain out the fluid. Number three, dehydration. Diuretics are often considered the first line medication for treatment of high blood pressure. It decreases the blood pressure by rid the body salt and sodium. It helped kidneys release more sodium into the urine. The sodium takes with it water from the blood, decreasing the amount of fluid flowing through veins and arteries. In this way, this reduces the body blood pressure. Types of diuretics. We have basically three types of diuretics. Number one, thiazide diuretics. Number two, loop diuretic. And number three, potassium spring. Each type have different effects on different part of the kidney to lower down the blood pressure. Now, case study. BA is a 62 years old woman who is postmenopausal. She does not smoke and never drinks alcohol. Since being diagnosed with the hypertension, she has modified her diet, began routine aerobic exercises, and has about 10 kgs over the past 18 months. She now weighs 72 kg and 165 cm tall. Her present BP is 142 by 94 mmHg and 144 by 92 when repeated, and has consistently remained near this value over the past year. Her BP when first diagnosed was 150 by 98 millimeter of mercury. No evidence is found of LVH or retinopathy. Urine analysis is negative for protein. Other laboratory tests are normal except for the dyslipidemia. BA has no insurance and is concerned about the cost of the therapy and pay full price for all her medication. Her Birmingham risk score is 22%. She takes over-the-counter calcium with vitamin D as she has osteoporosis and is started hydrochlorothiazide for hypertension. So we are supposed to tell that appropriate or the first line treatment for her is hydrochlorothiazide or not. So, SOAP notes: subjective, objective, assessment, and plans. Subjective: age 62 years old, gender female. She come with chief complaint of hypertension and osteoporosis. Medication: she started with hydrochlorothiazide for hypertension and calcium with vitamin D for osteoporosis. Temporal factor: evaluated Framingham risk score. Objective: vital sign: evaluated BP level 142 by 94 mmHg and 144 by 94 when repeated. As her all laboratory reports are normal except of dyslipidemia. Assessment: so it's assessed. Diagnosis: BP level is 144 by 94, which is stage 2 hypertension according to the American Hypertension Association guidelines. Differential diagnosis: dyslipidemia and osteoporosis. Plan: pharmacological treatment. We would prescribe thiazide diuretic as the first line treatment for the hypertension, and as thiazide diuretic is optimal for her because it may also be benefit for the osteoporosis and it's also inexpensive. We will start with low dose thiazide diuretic because the duration of action of thiazide diuretic is prolonged, so therefore we are starting with the low or minimum dose. Drug: we are prescribing chlorthalidone hygrotone drug. Dose is 1.5 mg once daily, and maintenance dose would be 25 mg once daily. Chlorthalidone: it inhibits the sodium chloride reabsorption in a cortical developing segment of the ascending lobe of Henle. It causes increased excretion of the sodium chloride water from the body. In this way, it lowers down the blood pressure and reduces the fluid from the body. Here is some pharmacokinetics information of the drug. It is 65% available. Onset of action is 2 to 4 or 2 to 6 hours, and duration is about 24 to 72 hours. Its duration of action is very prolonged. Plasma peak level is 1.5 hour. Drug interactions. Chlorothalidone is contraindicated with isocarboxylate when antihypertensive is combined with the monoamino oxidase inhibitor. It causes additive hypertensive effects. Thiazide diuretics is also contraindicated in diabetes, especially in type 2 diabetes mellitus. It causes development of the hyperglycemia and it resists glucose uptake and decrease insulin release by unknown mechanism. That's why it is contraindicated in diabetes. Apart from these all, we have some side effect of the drug that are nausea, vomiting, stomach cramping, loss of appetite, dizziness, headache, and etc. That's all for my topic.